Welcome everybody to the MGH Brain PBM clinic rounds. We're starting now the fall session. Today is October 22nd, 2021. And it is my great pleasure to basically present to you Dr. Thomas Henning, who is going to talk today about transcranial photobiomodulation for major depressive disorder, a private practice case study. I think it's very exciting to hear the experience of people who are doing this work every day. And I've talked about how important it is to, for us who are doing more research, to really hear about their experiences. So Thomas, welcome, and please take it away.
Okay, I liberate the monitor and here we go. Maybe we can, yes, okay. Dear Professor Paulo Cassano, dear colleagues, dear Fernando, thank you for helping in the last days. It's a great honor for me to present my empirical case to you today in your lunch conference. As a lone fighter in a multifunctional medical office in Starnberg, I try to make the results of my treatment with photobiomodulation tangible. Allow me, therefore, to present you 5 selected cases in this place today. Please excuse me, my English suffers a lot as I studied in Padua, Italy for 3 years and thus learned Italian as a second foreign language.
Let me...
Only many occasions I always want to show. I also want to I have another language in my ear. On my occasions, I also want to show you some photos of my practical work. All rights of these photos are mine. Because I come from a particularly beautiful area of Bavaria and Germany, I would like to show you 2 of our 5 lakes in this region in this picture. The main lake of Starnberg and the Ammersee. Maybe it's a suggestion for a holiday in Bavaria. Through a Congress contribution by you, Professor Paulo Cassano, and your colleague, Professor Margaret Naser, I came to photobiomodulation in 2019. A happy coincidence brought me together with Anja Füchtenbusch from COL.org and Charles Breda from Biophoton France, and I bought his Triwings S3, which is presented in these photos. You see the different possibilities of using the laser. In the little film, you see it in action. How many patients have been treated since interception of 2019? All patients treated with the laser were 124, men 54 and women 60. Therefrom, depression in first or second diagnosis, 60 people treated, men 27 out of 54, and women 33 out of 60. More than 1,400 units with 1 to 3 different programs were in this period used. It was not possible for me to translate all tables and graphics into English, not least because the program names are chosen very individually in expert mode. However, I believe that the figures and the program blocks are nevertheless understandable. You see that the diagnostic spectrum in ICD-10 evaluated with Beck's depression inventory and Hamilton depression scale, Dante anxiety and depression inventory goes from F31-8, which means bipolar disorder, up to the F48 neurasthenia, over the whole range of the affective disorders. So let me show you the exemplary 5 patient cases. The period is 3/2019 to 7/2021. The first case study is a male treated from May 2019 up to July 2021, from his age of 66 to the age of 68. He is male, pensioner, publisher, married, and has a 10-year-old daughter. His diagnoses are bipolar disorderness, initially tendency with hypomania and mania, altering with severe depression with somatic syndrome. Then emotionally unstable borderline type personality disorder, and formerly a polytoxicomania with an emphasis on alcoholism, benzodiazepine, and tilidine, abusus. Repeated stays in manic episodes in psychiatry hospital, psychosomatic institutions, and rehabilitation facilities. Then, as well, the marriage about 11 years ago and a 10-year-old daughter. Before admission to my practice, massive tilidine abusus, again with up to 5 grams daily. As you see, he started with a Zigis 1 at the beginning and then Hamilton 30 to 30. This first case, the patient was initially extremely skeptical about photobiomodulation and its effect. So before the basic treatment, I had to demonstrate an experimental phases with different programs of the laser. You see here the preliminary stage lasted 3 months with the experiments. As you see, the effect doses is lower than the dose used, as a distance of about 10 centimeters from the point of light leakage to the target region is used. Fluence means fluence dose number. In this case, 13 was executed within 5 sessions, several programs per session. And then you see the different program names: fluence, energy, number totally, time, fluence dose on totally, energy. This preliminary stage shows you up the different programs this laser has in itself. We have I will not go in detail for this, but you see that is a large point of pain which was treated. Then we started with my type of basic program, which is normally 1 to 6 treatments. In this treatments, 21 sessions in basic program are used. As you see, there is the first group, winter depression, which means seasonal affective disorder program, and the PBM program. And we have here 42 different programs used in 6 treatments in 6 days. As you see, we used 3,132 joule per square centimeter and a whole energy of 1,862 within 500 minutes. A little bit for showing you the intensity. We used very often the 12B and here the BB12C. I wanted to show you the technical details of the TRIWINGS. First, a 5-color LED laser panel with violet, blue, yellow, red, and infrared, with a whole treatment area of 900 centimeter square meter and a whole of 480 LEDs with 1 watt high power. You see here the monitoring of the TRIWINGS. In the basis left, you see the 0 monitor, then the seasonal affective disorder program, and beside the photobiomodulation program for 8 minutes. On the right side down, you see the factory protocols and then the expert protocols, which you can, as a user, program by yourself. After the basic program and the significant stabilization of the patient, a continuation of the radiation once a week with 2 programs was agreed with him. And therefore, we had a period now very long, more than 1.5 years. And we built up normally with 2 different programs in change, which means we used the PBM as one program and the seasonal affective disorder program as a base, and in change with another program which is called reposition or recreation program. You see here that we continued with a large quantity of times. We had a whole of 1,300 minutes in this period and about 5,600 fluence doses and the whole energy of 3,120. A little bit more graphic, the whole thing. You see that we have the 14B, very large in quantity. We have the 20B with very large quantity of energy, and we have as a main energetic program with 148 the winter depression. Usual, the combination is 1 program of the winter depression with 1 program of the photobiomodulation or the relaxation program. The conclusion of the treatment of DB is, since the beginning of the treatment, increasing stabilization both physically and mentally, maintaining abstinence from any addictive substance. That was the greatest luck in this case. Stability in drug therapy, currently 300 milligram quetiapine and 500 milligram ergonyl, 150 milligram buprion. The compliance of medication, psychotherapeutic treatment and photobiomodulation stable and good. The stability goes hand in hand with a higher ability to concentrate, which causes a patient to write a book about his life, which he has been implementing for about 3/4 of a year and has already put over 450 pages on paper. His wife reports that he spent time with his daughter again, has improved physically with cycling and gardening, and participates in general life again, in addition to family life. With great gratitude for this development, she is enthusiastic about photobiomodulation therapy. The patient himself insists on a repetition of at least 2 application programs once a week. And you see the Tegis changed from 1 to 7 to 8, and the Hamilton scale is shivering in between 70 and 21 out of 30. Let's see the second case. Yeah?
Would it be okay to ask questions per each case? I think it would be probably easier. Is that okay with you?
Yes, okay. Sure.
I will ask a question on the parameters. By the way, very encouraging case. So if I understand correctly, for this case, you've used your PBM kind of settings, which had 60 joule per square centimeter, 8 minutes, up to 36 kilojoule per session. Is that what it is?
Yes, yes.
Okay, and it seems like from the picture you are applying the light from behind, so it's kind of more occipital and then lateral, kind of parietal, occipital. Is it correct?
You see here two different ways, or it is brought from occipital to the parietal places, or it is made in the other way. Stop where it is. Just I'm in the wrong way.
So he received it alternated to the two types of
here you
administration.
Here you see the picture as a helmet, from occipital up to frontal.
Up to frontal, I see. And so it was obviously a fairly broad surface, and then there was this distance of about 10 centimeters in between the panel. Okay, very good, very interesting. And one curiosity I had is that you mentioned the effects on the abuse and dependence of different substances. It seems like the effect was broad. It wasn't just limited to opiates, like Fred Schiffer has described in his cohort, but it also was in the addiction or dependence or abuse of benzodiazepines and alcohol.
Yes. But before his marriage, he was a very wild polytoxicomani, and he was really using all stuff out of the street, from alcohol to cocaine to all things. And when I came in his life, he was on Tilidin with 5 grams, and we got lost of this within a period of 3 months. And from that point on, we made the treatment as a basic treatment, and then the continuous treatment.
Okay, so the effect
and in this period, from this first 3 months up to now, up to today, he is clean and he is not using anymore any drugs.
Okay, so the effect that you noticed with this treatment was also just exclusively on opiates, on Tilidin.
Yes.
Got it. Any effect on the borderline personality traits? I was curious if
That is in this case, I think, because of his age, he's 66 to 68. As Linehan already described, after 30 years, it is lowering the intensity of borderline disorder, and he is over 60, and that is not more the problem, I would say.
Got it. And also the wavelengths you used, your device had several wavelengths. The wavelengths you applied were the infrared, the 850 nanometers, or you applied multiple wavelengths in this treatment?
That is quite difficult to explain because the programs are very sophisticated and differentiated. But you are using the quantity in totally, and you can with these programs not clearly say how many exposure is there. I'm here not the techniques, and I'm not trained for this to specify this in a great profundity. But the thing I understood from Charles Breda is that around the 5 colors, there is a minimum and a middle and a large quantity of nanometers. And they shiver this for the programs in different ways.
And I want to open it up. I took a lot of the space here. If anyone has any questions specific to this case, feel free to jump in. Okay.
It seemed that you used different parameters with this patient. Did you find that there were some parameters that were more beneficial or less beneficial?
It was a lot of beneficials, and he was very, very successful against pain, and that was the basic for.
I'm saying the light with the light parameters. It seemed that you used different parameters, if I understood.
Yes.
And were some parameters more effective than others?
Yes, therefore I increased the use of some of the programs. As you see, there are those which were long on this side were used very often, and that is something which in the combination of the other program is always going to 40 minutes, and one treatment in one session is 40 minutes for the patients with 2 programs or 3 programs. It's okay for you?
I think we can move on if there are no other questions. I cannot see all the everybody, so anyone wants, they can just pick up. So
case study second is AG, a treatment between April 20 to July 20, a closed treatment from a male aged 54 to the age of 55. He had his birthday in between. Specialist service officer, captain of the military, married in second marriage, 2 adult daughters from first marriage. A severe depression disorder. At the beginning, Hamilton depression 29 to 30. CGIS, I couldn't find anymore. I'm sorry. Here I show you, I took this case for show you the structure of the basic program. is designed with a complete treatment, and you can see the 3 programs are applied several times instead of 2. You see the times are going from 20 April 20 to 22 July 20, and you see how I structure the treatment normally. In total, we had affluence of 1,404 and an energy of 821 within 280 minutes. And as a quantity of the programs, you see here that there is an highly requested program, Winter Depression, or the Winter Depression 12B. And on the other side, the BBM 20 and the BBM 12C. Very low, both programs of reposition, which is in this case not really important. The conclusion of the treatment: since the beginning of the treatment, increasing stabilization, both physically and mentally, reduction of drug therapy, currently escitalopram 10 milligram, previously 20 milligram, plus olanzapine 10 milligram, but only for a couple of weeks. The compliance for medication, psychotherapeutic treatment, and for the biomodulation stable and good. The stability goes hand in hand with a higher ability to concentrate, a regulated sleep-wake rhythm, the ability to reassume libido and sexual intercourse, drive improvement and memory normalization, decision-making and decision implementation normalize. The patient and I ended the treatment at the end of the basic program, plus two supportive refreshers, which we made a fortnight after the ending of the basic treatment. Any question for that?
Sure, I do have a few questions. So I was curious, the decrease in SSRI, was it related to associated or justified, I should say, by the presence of sexual side effects or other side effects? I was curious why the SSRI was decreased.
Yes.
That was the reason. Okay.
Yes.
And
he was absolutely without libido, and that was for him something very, very important, because he has married his second wife only a few months before he came to me.
Got it. And what's your experience integrating SSRIs, but also psychotherapy with this transcranial photobiomodulation? Do you see any particular combination in terms of psychotherapeutic interventions and PBM, or medication and PBM, that are particularly effective in your experience?
Of course. The first case, for example, we could get rid of one of the trauma from the patient. It was one of the first sessions of the basic treatment, where he had a real heart arousal about some of his traumata during the very hard polytoxicomania. And here we could elaborate psychotherapeutic treatment on this problem, and he could get rid of it. And as well, this case too, he is in the military, and he was in Afghanistan and had seen there some really awful details of one of his intervention there in Afghanistan, and we could get rid of these images after treatment and talking about it.
Thank you. I don't know if anyone else has questions. I don't want to take all the space here. Feel free to jump right in.
So go on.
I may have a quick question. Excuse me, this is Hanli Liu.
Yeah.
Regarding your energy table, could you please go back to that table just about total energy? The one more back, I think. Now let's see. In terms of analysis, the one you listed total energy, I think it's 830 some number. Is this the one or two? Maybe forward.
It's a first case. I think you are
no,
looking.
I think yeah, no, this one. Sorry then.
Yes.
What I mean is you have a unit of a kilojoule, and then it means 1,679. I mean, some number, some table is like this. So you have 1,000 kilojoule energy delivered.
Yes.
I just want to make sure.
Yes,
right?
but you know we have a distance from the leakage of the panels up to the head of 10 centimeters, and then there is the hair. And it's arriving less energy on the normal treatment. That is a real large sums, but I think that is not the problem. The problem is temperature, and the problem is coolness of some of the programs. I have recognized that programs which make a normal warm environment is easygoing for patient and makes more effect than the cool programs, which, for example, is the seasonal affective disorder program, which is nearly cool in temperature. And I don't think that that there is a great mass of energy necessary for entering. And because of the distance, it is equalizing for me. As for lasers, which are hand lasers or direct lasers for the nose or for the ear or something like that.
Okay, thank you.
And if my understanding is right here, that's a cumulative estimate. It seems like your average treatment exposure is around 60 kilojoule. Is that right, Tom?
Yeah.
Thank you.
Sorry, I have a comment on the parameters.
Come on in.
May you please go to the slide number 11 or 12?
To this?
Yes, 11.
Yes.
Yeah, I saw something about 3,000 joules per centimeter square.
Yes, that's the whole. That is the number of programs as the program is coming, and there is the number of the treatments. 3, 12, 2, 1, 1, 1, 23, 42, and that is the whole. One program is 54, 32, 74, 44, 54, 32.
All right.
You see this?
But with all respect, in
And
terms
then
of
there
technical,
are the numbers of the whole explosion.
yeah, in terms of the technical, reporting of the parameters, we don't have such things of accumulating the fluence.
Okay.
For the energy density, we can just say the number for the, based on, beam parameter of beam area, time, and actually the power. We can't
Okay.
accumulate the energy density of each, sections. We can do that energy or dose, but we can't say 3,000 joule per centimeter square.
Okay. Okay.
Could I add a comment here? This is part of the things. By the way, I'm glad to see some people's faces because we don't have a chance to meet in person. But anyhow, 54 or 48 joule per centimeter square. That's really high. I mean, again, in terms of the laser power density we use, again, following Dr. Gonzalez Lima's suggestion, we have 250 milli. Oh, sorry, that's watt. That's the power. Okay, never mind. I got to calculate that. Sorry for the confusion.
Okay. Okay. So we go on?
Yeah.
Yes, I think we can. Thank you all
Actually,
for your
if
comments.
we have the 70 joule per centimeter square over the scalp for example, 810 nanometer light, then we have a chance of delivering less than 2-3% of that light, and then we have less than 1 joule per centimeter square on the cortical surface. Then 70 joule per centimeter square for the frontal region would be fine, but we can't say 140 or 210. We can't multiply that to 2, 3, 4 for each sections. Am I clear?
I think so. Yeah.
Yeah.
Okay. Case study 3 is female HK. Treatment period is June 2019 to July 2021 and will be continued if necessary. From the age of 66 to the age of 68, female retired primary school teacher, married, childless, rather sporty leptosome habitus. Years of anxiety from serious illness, sleep disorder, appetite disorder, depressive withdrawal, and isolation. Recurrent depressive disorder, major depression episode with somatic syndrome, anxious avoiding personality disorder. Secondary diagnosis, cervical and lumbar metabolic syndrome after lumboischiatica, hair loss, sciatica, neuralgia. When I take it to my practice, Hamilton depression 30 out of 30, CGIS 2. This case was chosen because it shows very nicely that with successful basic program from the patient's desire to have secondary disease treated by laser. A secondary treatment, herpes, pain, orthopedic problems were additionally treated. You see here, again, different programs which are treated after the basic program. And you see that there are treatments only 1 or 2 or 3 times necessary for getting rid of the malessere. Oops. What happens now? Good. We see here the main treatment, and it is division in 3 parts. First of all, the winter depression area is combined with the PBM, and here you see that we had a great amount of PBM program in this case, because it's very often combined because of the somatic syndrome. For that, it is a special attention necessary to the somatic syndrome, and here to the pain. It has proven to be particularly valuable to treat the pain separately in combination with photobiomodulation standard program. You have to imagine that first the basic is treated, and then the patients come with diverse pain attacks, and thus are treated again. The conclusion of the treatment of HK is, since the beginning at the treatment, increasing stabilization both physically and mentally, treatment was continued once a week at the end of the basic program in consultation for half a year. After which symptom specific was continued with up to 3 treatments per 14 days. First of all, reduction of drug therapy, currently escitalopram 10 milligram, previously 20 milligram, as well as at night trimipramine 100 milligram. Compliance for medication, psychotherapeutic treatment, and photobiomodulation very high. Good introspection ability and introspection. Stability is accompanied by a highly ability to concentrate, a regulated sleepwalk rhythm, the ability to resume libido and sexual intercourse, drive improvement, and memory normalization. This patient particularly appreciates the fact that she was able to leave her isolation and reassume and normalize social life, including sporty and partnership relations. The patient is very convinced of the treatment with her happiness laser. She was also learned particularly well to come on time. CG scale changed from 2 to 8 after the first treatment period of about half a year.
Thank you, Thomas. And this is what I see here. It's really the same struggles that we experience in our clinical practice about tolerability and add-on to other treatments. About this specific patient, I was curious. So I just want to make sure I understand here. Were the somatic complaints just a presentation of the psychiatric illness, or were there also physical causes for the physical pain? And also, did you just treat the head, or did you treat other parts in the body?
First of all, the basic was always the head. And in the second view, we made the treatment onto the somatic syndrome. And therefore, it was longer than the normal 6 treatments or 6 to 8 treatments at the basic program.
So you treated both the head and the body?
Yes.
Got it. Thank you. I don't know if anyone else has questions.
Well, just to clarify, Thomas, so your basic treatment is 6 to 8 sessions, and these are daily sessions or weekly sessions?
No, it is, I combine this in the way, the first week, normally I do 2 basic programs with 2 to 3 sessions, which means Monday to Tuesday, Monday to Friday, first week, 2 times irradiation. Then the next week on Wednesday, and the continuous treatments are one week later. And if there is a necessity, that is something I changed in the last year, for example, to treat body, I make an interim, which means on the second week, I start with the treatment of the lumbosacral pain, or of the shoulder or of the head, beside of the standard of the basic treatment.
Thank you.
Others?
Yeah, I think I don't see everybody, but unless someone speaks, I know we only have 10 minutes.
Okay, that is. So I go through very fast here. It's a treatment April 2019 to September 20. 62 aged female retired medical technical employee, widow, childless, athletic obese habitus, after falling from the horse, acute appearance of anxiety, sleep disorder, depressive withdrawal and isolation, self-insecurity, pain in the hip and lumbosacral. We have the recurrent depressive disorder, major depression episode with somatic syndrome after fall trauma hip, acute stress disorder, lying fall syndrome after fall with rosatia facialis, and when recorded in my practice, Hamilton 27 out of 30 and Segi 3. Here I show you only the beside things, like rosatia is the face treatment. Then another treatment with a skin injury she had, and healing of chirurgia. And then that was a more important thing. The two main treatment, including basic treatment and pain treatment, with a total of 11 sessions. 16 different programs are used. The Fluence total dose is 2,326, and the total energy 1,376. A total time of 506 minutes. I do not explain this in detail, but you see there are different programs used. She was very happy about this. She was not amused taking drugs, and so it was rejected. The stability is accompanied by a subjectively perceived higher ability to concentrate, a decline in anxiety and the self-esteem problems, a regulated sleep-wake rhythm, the reintroduction of libido, living isolation, and resumption of social, sporting, and friendly relationships. The patient is very convinced of PBM treatment, especially because she did not need any medication. That is a group of patients in Germany now, because of they are very often coming to my practice because they won't take any medication against depression, and wants to try the laser instead. The last case is a special treatment, and is in particularly meaningful because it's a combination of different clinical pictures and the simultaneous irradiation over the head. In particular, you can see the application of a wide variety of programs on the head irradiation with a modality reinforcing and improving results. This female, 83 years, divorced, childlessness, came with an awful actin keratosis after surgery and wound healing disorder with bed sore infection. really awful. The addiction was a recurrent depressive disorder with moderate episode. She has an alopecia in surgical environment, exhausted and written off. Then a fungal infestation after antibiotic treatment, globally increase of hair loss, a cognitive mild impairment. You see here the pictures within 3 weeks. Without any antibiotics, without any other things, as a cleaning surgery with cleaning the areas, and within 3 weeks, occluding of the wounds. So you see here the normal position for this patient. Here, still a picture of the monitoring. You see the combination of a lot of programs from the Trivings. Here, actinogen keratose, decubitus, and wound infection in combination with PBM and photobiomodulation. I have the conclusion for this treatment. Since the beginning of the treatment, the increased stabilization both physically and mentally, special appreciation, healing wound without antibiotics, compliance for photobiomodulation very high. PBM is precise as strengthening in various areas. I just feel better after irradiation. Stability is accompanied by a subjective perceived higher quality of life and wakefulness, regulated sleep-wake rhythm, and daytime aviation. The Zegis is going from 3 to 8, and because of the positive course, the patient comes regularly today because she's good for her in the head. At the end, I'm very happy and satisfied that I can present you this empirical conclusion of my work, and I believe in the summary of other treatments with photobiomodulation that this result is representative in my practice. Photobiomodulation for depression is effective. The quality of life is clearly improved and strengthened by treatment with photobiomodulation. Mild cognitive disorder are improved. Concentration and memory is improved. Isolation tendency is lost. All patients indicate significant improvement here. Medication is reduced or replaced. Fatigue and sleep disorder are harmonized and stabilized. Combination treatments over the head complement and intensified. Compliance for the treatment constantly high. Cost-benefit rating highly positive. Side effects neglectable. Repeatability and reproductibility of the result given, and patient satisfaction proven by Zegis. The result of the patient survey, a subjective impression of individual treated patients, strengthens me in my work and in my efforts to be able to help patients with mental illness and brain disorder through photobiomodulation. As the patients value the following changes: the brightening of depressive syndrome, return of libido and sexual intercourse, increased memory and concentration, avoidance of medication with psychotropic drugs, manageable time expenditure, repeatability and possibility of renewal, use in case of other disorder, and a low cost are arguments which patients always continues are showing up. I thank you for your patience and hope that my English wasn't too bad for you.
Thank you so much, Thomas. I mean, these were really inspiring cases, And so I know we have probably 1 minute if there is a question. Thank you again for presenting today.
I think.
Yeah. Thank you, Paulo, and thank you, Thomas, for this wonderful wonderful presentation. I'm a psychiatrist and sleep medicine specialist from Taiwan.
Okay.
My name is David, and I'm glad that I have the chance to collaborate with Paulo. But there was a very strange feeling for me that some people, feel that PBN can help them sleep, while some other patients actually felt this photobiomodulation quite stimulating. What's your general impression using this for their fatigue or sleepiness?
I have both cases in my practice, but it's a larger group which are relaxed and sleeping deeper and have a good combination of awakeness and sleeping.
When you say sleep deeper, do you have like a polysomnography, or is this just a subjective feeling?
No, I only have the rebound from the patients.
Thank you.
Thank you all. We're out of time. Thank you for participating, and I hope you'll keep coming for next session. So thank you again, Thomas. That was terrific.
Thank you, Paulo, for invitation. It's a great honor for me. Bye-bye.
My pleasure. Bye now.